Good morning, students. We have seen about general instruction about heart, like the structure of heart we have seen. Today we will see about the coverings and walls and chambers and valves of the heart. So the covering of the heart is called the pericardium. So this pericardium is divided, we can tell as a pericardium and sinus pericardium. If we see the pericardium again divided into fibrous pericardium and serous pericardium. So serous pericardium have two layer. What is the two layer? Parietal layer and the visceral layer. Okay, so the pericardium mainly made up of the pericardium is a fibrous layer. It is a fibrous layer where the great vessels are really entering there. That is called sinus pericardium, where the point where the great vessels are really entering, which is called the pericardium. If you look at this picture, it is a fibrous pericardium. Fibrous pericardium, it's like a cone shaped structure. It is made up of the collagen fiber. The apex outer layer is the great vessels. This is the apical part where the great vessels are entering. Understand? Great vessels are entering. And the base is attached with the central tendon of the diaphragm. It is attached. So in the anterior side of this one, by the sternum. What is the sternum? Fourth or the fifth intercostal cartilage, which is this one. Posterior side will be, this is the back side. Posterior side will be the fifth to eighth thoracic vertebrae is present. So the base is attached by the central tendon of the diaphragm. And this is the, what is the structure of this one? It is like a cone shaped structure. Okay, it is, what is the layer made up of? It is made up of the collagen fibers. Next one, if you see, it is a serous pericardium. This serous pericardium, it has got a two layer. One is the parietal layer and the visceral layer. Parietal layer, which is covering, which is down to this fibrous layer, fibrous pericardium. And where is this visceral layer? Visceral layer is covering the inner portion, like it is in front of the epicardium. So in between there will be a fluid. This fluid, in between the fluid, is called the pericardial fluid. So what is the function of this pericardial fluid? It will prevent the friction. So any infection or inflammation of this fluid is called the pericarditis. Sometimes the collection of the excessive fluid, it is called the pericardial effusion. So what is that? Inflammation of the pericardium. It is called by bacteria, virus or anything is called the pericarditis. Okay, collection of the fluid, also excessive collection, it is called the pericardial effusion. Next we will see the walls of the heart. Walls, the outer layer called the epicardium. It is formed by the visceral layer of the serous pericardium. So it is consists of the mesothelium. It consists of the mesothelium. That is called the outer layer. Then if you see the middle layer is called the myocardium. Myocardium is otherwise called the cardiac muscles. What is the main importance of this myocardium? It is playing a very important role in a conductive system of the heart, where the Purkinje fibers, all these things. Why it is in the lower portion? Because with the conduction of the heart will be helpful for the contraction of the heart. In a forceful contraction will taken place. Next is called the endocardium. Endocardium, which is lines the heart and the blood vessels entering or leaving the heart, whatever the blood vessel. So it is helpful. What is this one? It allows the smooth blood flow it is allowing. So this is the main walls, heart walls or the walls. If you see, there is a pericardium. How this pericardium is divided into pericardial coverings. Or we can tell as a pericardium and sinus pericardium. Then fibrous pericardium, serous pericardium. Serous pericardium again divided into parietal layer and the visceral layer. And what is called sinus pericardium? Sinus pericardium where the sac is formed, where the point where the great vessels are entering. Understand? Then if you see, you can draw one rough structure. No need to draw these papillary muscles or caudate tendinae. When they are asking only the coverings of the heart, no need to mention all these things. Just even the great vessels you no need to draw. Just draw the layer of the heart and just first mark. What you will be first marking? First the fibrous pericardium. Just give some color coding of this fibrous pericardium. Then you draw the serous pericardium. Serous two layer, right? Which is covering the fibrous pericardium. It is called the parietal layer. And the visceral pericardium, which is present in the width of endocardium. Its relation with the endocardium. That is called the serous layer. And down portion, since you have layers you have mentioned, so you can mention the same picture in the down itself. You can mention about the what is called epicardium, myocardium and endocardium. Okay, then you can between these yellow color you can tell as a pericardial cavity. By looking at this itself, you can there is a fluid is present. You can mark also. This is called the pericardial fluid. When this is excessive fluid, you can tell as a pericardial effusion. Okay, the collection or any inflammation, any bacterial or viral inflammation, that will call pericarditis. You will be telling ITIS. You will be writing for the inflammation. So this is very simple. You can divide. First you write about this one picture, mind picture, concept mapping. You make it and draw the symbol diagram of this, and you can very well describe about the coverings and the walls of the vessels, walls of the heart. Next we will see about what is about the different valves of the heart. Now we have seen the coverings of the heart. Next we will see the valves of the heart. So before seeing the valves of the heart, you can draw one symbol diagram of the heart, right? Either you can draw this side as a 4 you can draw, or you can draw the 4, this one, this you can divide into 2 and very simple diagram you can draw. Because any diagram you just draw and explain, it is very easy. Otherwise what will happen? You will be afraid too much. So rough diagram, no need to put much effort like that, but one diagrammatic representation will be better. So you can tell very well what is coming. This is the big vessels, just coming, you can draw like this. Okay, so by this diagram you can very well, what first before going to the valves, we can see the chambers of the heart. This is called right atrium, this is called left atrium, this is called right ventricle, this is called the left ventricle, isn't it? So this right atrium, isn't it, which is having this one, 2 great vessels are there. This is called inferior vena cava. This is called the superior vena cava, isn't it? This right atrium and left ventricle divided by the septum. Okay, so ventricular arterial septum. This one right ventricular or atrioventricular septum. Atrioventricular septum. Septum is the one, the division which is called this one. Here in the left atrium there are 4 openings here. What is this 4 opening? This 4 opening is called pulmonary veins. Okay, this is the right side of the heart. This is the left side of the heart. This is the right ventricle. The lower portion of the heart, which is called the ventricles. The upper portion of the heart is called the atrium. Correct? So this lower ventricle is more thicker than the ventricles are more thicker than the atrium. Okay, this is called the left ventricle. So what is this, which is called, this is called pulmonary artery. All the arteries usually will be carrying the oxygenated blood, but only in the circulatory system, only pulmonary artery carrying the deoxygenated blood. So the right side of the heart, all present is called deoxygenated blood. How? The deoxygenated blood is coming from superior portion of the body, upper portion of the body through superior vena cava, and from the lower portion of the body by the inferior vena cava. So once they come, this is called valve, isn't it? Valve. What is this valve? You can tell us a tricuspid valve. Okay, this is tricuspid valve. This is called bicuspid valve. So this is the bicuspid valve. So any inflammation of this valve, the valve will become very thick. So there will be regurgitation of the blood. So how the valve will be? Valve will be so flexible and looks like a rubber. So it is have elasticity. You might have seen in the hospital giving injection. There is a bottle. There is a glass bottle with a rubber covering will be there. But even you shake the bottle, the water will not come out. Once you take out that rubber and you heat it, and it will become so rough, right? And why this inflammation and all, further classes we can see this one. So this valve, and this one is called pulmonary valve. Okay, this is called aorta, right? Aortic valve. So this aortic valve. Even this one, if they ask you structure of the heart, you can draw this picture. When they are asking the like the walls and coverings of the heart, no need to draw the greater vessels or cardiac tendineae or the papillary muscles, nothing. Just you can draw the covering. Here you can write the layers. Here you can write the muscles. What is that covering? Walls like epicardium, myocardium, endocardium, and fibrous muscles or whatever it is made up of, what you can explain. So dear students, today any questions coming as the form of a 2-mark question regarding the coverings of the heart or walls of the heart, chambers of the heart, valves of the heart, walls of the heart and valves of the heart, you can make one mind or the concept mapping. So pericardium divided in two by fibrous pericardium, serous pericardium, sinus pericardium, right? This pericardial muscles, again fibrous pericardium made up of the fibrous, isn't it? It's a mostly apical part. It's like a cone shaped structure. Serous pericardium, 2 layer, parietal layer and visceral layer. If you know all these layers, then with this layer you can mark, and then you can write the epicardium, myocardium, endocardium, you can write it, isn't it? The serous pericardial visceral layer, where the layers covering of all the layers like aorta, pulmonary valve, all these coverings mainly by this layer. And what is sinus pericardium? Where the point where the great vessels are entered, the sac is formed, is called the sinus pericardium. So this is the coverings of the brain. And about the walls of the brain, again you will be telling about the heart walls are epicardium, myocardium. This is the bigger one, myocardium, then endocardium. So endocardium. So there is a thin layer. There is a thin cavity which is there, that's called pericardial cavity. There is a cavity in the sense, space, the air space is present. So this space, there is a thin liquid or some fluid is present, isn't it? That is called pericardial fluid. So in the pericardial cavity there is a fluid is present. So this pericardial fluid has got some anatomical importance. What is that? The pericardial cavity, the fluid, if it is so excess, it is called pericardial effusion. It's so difficult for the heart to pump it. If there is any inflammation, that will call pericarditis. Understand? And if they ask about write short notes on the chambers and the valves of the heart. Just draw one rough diagram. Never mind about, first mark the parts. Human heart has got the four chambers. So upper chamber are called atrium, lower chambers are called the ventricles. Upper chamber is thin, and this lower chamber is more 3 times more thicker than the atrium, correct? So, and then you can say the right side and left side of the heart also you can divide. Right side fully deoxygenated blood is present, and left side will be the oxygenated blood is present. Then you write the heading of right atrium. You put one small heading by looking at the picture. Then you write what is present there. Imagine your own English, you can write what you can write. You have already marked what is called superior vena cava, inferior vena cava. You tell that in the apical portion of this there is a the great vessels which is coming is called superior vena cava and inferior vena cava. They are bringing the blood from the part of the body. Understood? And then the left atrium. Left atrium, there are four openings there in this small, this one, isn't it? So this one, what is the name of it? Okay. Then if you down portion, you will be seeing that, and this heart is divided by the right and left by the atrioventricular septum, and you will be writing about ventricles. So you know this since you already explained this, right side is deoxygenated blood. Of course, there is a one artery will be taking this, is called the pulmonary artery, taking to the lungs. Once it is getting purified, isn't it? It is taken by the pulmonary vein and it is bringing to the left atrium. So you will very well be knowing this is called the pulmonary veins, or four veins are present, right? Once there is a pressure is increasing, the valve will be going to open, and then the left ventricle are having a oxygenated blood. Once the pressure is increasing, the valve will be open, is called the aortic valve, and will be taken the blood to the body. So it's a greater vein, right? And then you can mark what all this one, it is tricuspid valve, this mitral valve or bicuspid valve. You can diagrammatic picture, no need to mug it up. Just you can write the concept by your own language, you can write it, but the diagrammatic presentation will be better in doing in anatomy. Okay, thank you.